Good day, everyone. My name is Dr. Ne, the Medical Director of the Richards Clinic, the Chronic Pain and Wellness Center. I welcome you once again to a series of lectures on arthritis. And today, we are going to look into why arthritis has continued to remain a difficult disease for many doctors to handle, as well as being confusion to patients. We have got many reports, many patients telling us that their doctor has told them that it's a disease they would have to live with. It's a pain they would have to manage for the rest of their life, that there is no solution, there is no cure, which I find baffling at this stage in the development of science and medicine. We still have people that think that some diseases still remain untreatable. So we're going to look into that, and I gladly welcome you to this lecture and ask you to pay attention. And at the end of the lecture, if you have more questions, more clarifications, you can always ask us. Number one, there's a lot of misinformation out there. And number two, majority of us are still stuck to the old knowledge, not knowing that new developments are in town. So research has been active, and a lot of new things are coming up in the medical world. And most of the diseases we thought do not have solutions are beginning to have solutions these days, and arthritis is one of them. Therefore, if one is still sticking to the old treatments of arthritis, it will not be surprising that the person will continue to get the wrong result. Now, for any medical condition, there is no way you embark on any treatment without a proper diagnosis, which is what I found at people, especially those who come to us. They have been taking treatments for months, for years, but they have not really done any diagnosis to find out what the problem really is. If you are having joint pain that is more than 3 months and you are taking any form of treatment, whatever the treatment is, I have not done any test like X-ray or MRI, you are already on the wrong path. Just as we said in the last lecture, it is degeneration that is arthritis. Arthritis is not just joint pain. To be clear, one thing you will take home from this lecture today is arthritis is actually a very deceptive disease. It manifests as joint pain, and unfortunately, it will turn the attention of the patient and even the doctor to the pain. You see the doctor prescribing all kinds of drugs to tackle the pain. Why the arthritis is in there causing this destruction in the joint. So while you are tackling the pain, the joint is progressively being damaged. So is the tissue damage what we call degeneration that is arthritis. So if you are taking medications, painkillers, supplements, exercise, whatever it is, to help you feel pain-free or reduce the pain, without tackling the degeneration, it is tantamount to pouring water on stone. It will not, there won't be any effect. Even though the pain will go down, it will still come back with vengeance. So any treatment targeted at arthritis should target the degeneration of the ligaments, cartilages, and even the bone. How does it happen? How does it all start? Arthritis starts with the soft tissues of the joint. Let me take a few minutes to describe how the joint is formed anatomically. So you have two bones, usually two bones coming together. Those two bones are held by the ligaments, which is very tough, fibrous tissue. Of course, you have eaten chicken before, the leg of the chicken, when you try to break it, there's this white, thick strand that holds the two bones together. That's arthritis. It is whitish in color because it doesn't have so much blood supply. And any tissue that doesn't have good blood supply doesn't heal very well whenever it is injured. It needs an added help. So these ligaments hold the joints in their normal anatomical position and allow a specific range of movement. These bones are also, we call them articular bones. They are also covered by cartilage that helps them to glide over each other smoothly. Then these are all wrapped with what is called the joint capsule. So inside the joint capsule, you have a small thin membrane, small thin layer called the synovial membrane. The synovial membrane produces tiny fluid to lubricate the joint, and that fluid is known as synovial fluid. Then you have things like we call bags of water, they are called bursa, that also wraps the ligaments and not prevent them from eating into the bones when you are moving. They won't be scratching the bones and all that. So this mechanism is wonderfully made by God. But when arthritis wants to attack the joint, it usually starts with the soft tissues. It can start with any of this synovial membrane, the joint capsule, the ligaments. But the problem starts when the ligaments are attacked. With time, just as I said, because they don't have good blood supply, they hardly could heal 100% back on their own. So they begin to get weak, and when they weaken, the next thing that will happen is that the joint will begin to move beyond their range of motion would increase, what is known as hypermobility. They move beyond their range, and that will cause more pressure on the cartilages that covers the articular bones. So mechanical events will now set in, leading to wear and tear of the cartilages. And also know that when the ligaments and all these tissues are injured, let's use the word injured, a lot of biochemical events also happen, meaning that some chemicals, some materials, some things will be released in the joint. Most of them will harm the joint further. Some will be trying to heal the joint. So it becomes a battle between the destructive elements and the reparative elements. Most times, the destructive elements will have upper hand. So I wouldn't bore you with all the medical jargons and names of all these destructive elements, but just realize that there's always a battle between the good and the bad. The good means the chemicals that will try to heal the joint, while the bad meaning those chemicals that will destroy the joints further. So that's why it seems arthritis is very, very progressive, going from stage 1 to stage 2, stage 3 to stage 4. But when all these things are happening, what you feel is pain. When you take the painkillers, it's just to reduce the pain, which is just a symptom of arthritis. It does not heal the ligament, it does not heal the cartilage, it does not heal the bone. At a point, the healing treatment we knew was surgery. So when so much had been eaten into the cartilage and the bones, what is done is to cut off those parts and replace them with artificial materials like iron. Sometimes, yes, certain stages it might not really go for knee replacement or joint replacement. You can do arthroscopy, which is when you look use a fiber optic tube, get into the joint, use some scraping to scrape it off to allow the new fresh surface to appear and hoping that they will regenerate and heal the joint. But with research and findings, we have been realized that you may not need all this surgical intervention. You can use regenerative medical treatment in which you harvest regenerative elements from your own body. It could be the platelets, it could be the stem cells from the bone marrow or fatty tissue. And when you inject them inside the joint, they release what is called growth factors, which begin to work on all these structures and heal them. So, medically, without surgical intervention, the joints can be healed back to normal. But this is with a caveat. How well, how quickly the healing happens depends on the stage at which this treatment is started. The smaller the damage, the little that is needed to be healed, and the faster the healing, and most times the more permanent it could be. But the more the damage, the longer it takes, and sometimes it might not even achieve 100% healing. So, regenerative therapy is the treatment of choice for arthritis. It has high efficacy, better than surgery at some level of arthritis, and much, much, much better than medications you can take by mouth. So, this is to let us know that all the information you have out there that arthritis has no cure